I like it.
Yeah, I will use that.
All right. Well, hello, everyone. Thanks for joining in. Good morning, good evening, good afternoon, wherever you are. My name is Gary Yeoman.
And I'm John Beradino.
And this is The Middle. And today we're going to be discussing well-being. And I'm going to let John start off with a definition of well-being and what we believe that encompasses in total.
Well, we're going to look at the medical, we're going to look at the physical, we're going to look at the mental, we're going to look at maybe even the spiritual, as we use it in the clinical field, psycho-biosocial. It's a comprehensive understanding of the ways in which we approach all aspects of our lifestyle, and what that means hygienically for us. When it comes to hygiene, we really want to take a look at the various areas of our life that are susceptible to toxins. And toxins for us can be something that that interferes with the enhancement of our life experience. It could be something that interferes, disrupts, creates any type of disorder or imbalance. When we talk about symptoms, we want to make sure that we recognize that there could be a disease, there could be a disorder, there could be something that's trying to capture our attention to bring us back into harmony. So if you think of homeostasis, which is most of us are what we're familiar with, if something goes awry in our body, it tries to bring us back. A fever is a perfect example of that. If there's a pathogen, fever comes, blows everything up, and then tries to bring us back to harmony, but it does it through pain. What we're going to be talking about today is the ways in which maybe we're going to experience some type of disorder or symptom that reminds us that our system is out of balance, whatever system that is, whether it's our physical or our mental or even our relational life. A good portion of what contributes to problems in our relationships is avoidance of conflict. And the avoidance of conflict then prevents the opportunity for resolution and the restoration of harmony. So we'll be kind of covering all of these areas today, but well-being in its essence is a comprehensive understanding of the ways in which holistically we manage all systems and various areas of our life.
Right. So this is sort of an addendum, I would say, to our men's health episode. And, we thought we were going to get through a lot when we actually started with that. But as it turns out, we got through cardiology, basically, the fundamentals of it and what to look out for with the heart and everything. Yeah. And there are so many more things to encompass. And not only that, I don't think we spent enough time, and that's why we're doing this podcast on looking at the emotional impact of disease and vice versa, the emotional impact. I should say. How do I say that? So you got to go in both ways. So you get the emotional impact of disease when it happens, but you have disease that also has an incredible emotional impact. Yeah. And this goes back to the story that I talked about with Pat and how after he had his heart attack, he was in sort of a panic mode, and a lot of men just sort of suck that up and just toughen it out. And really, what they need to treat everything. So maybe they've had a bout of cancer, and I'm going to talk a little bit about skin cancer because it's so preventable, or they've been diagnosed with prostate cancer, and these things are just giant to them, and so the head needs to be treated. I'll just say, you need therapy to deal with those kind of things.
There's an interplay, there's an exchange. I think the problem that we've had, especially in American culture, is the specialization, meaning we'll take a part and we'll focus on it. So you go to this doctor for this, you go to this doctor for this. Even if you go to a doctor about, let's say, like diabetes or something, when you want to talk to them about nutrition or other deeper underlying issues that help your well-being, it's not going to be there. They're focused on the pathology and how to help you from there. Yeah. So we're going to talk about it in a way in which we can try to see these things holistically. Notice there's an interplay and an exchange, and we have to be aware of the ways in which the mind, the body, and the heart work together.
Right, exactly.
Yeah.
So I think maybe we could start out with, in terms of the physical aspect of it, some common things that I missed last time because we just didn't have enough time to talk about it. But so one of the things is skin cancer. And I'm going to talk directly to that because I've had skin cancer, and it's one of the most treatable and preventable type of cancers that we can get. But men actually die from melanoma at a rate of almost double that of women. And a lot of it is because we don't check ourselves or we don't get to a dermatologist to be checked over. But I had skin cancer just below my eye, and they had to take a piece of skin across my left eyelid. And I know this might kind of freak you out a little bit, but it's called Mohs surgery, and they had to fill a hole here where they cut the skin cancer out. And we don't control at this age, which is where you're going to see it, and from your 40s on is when you're really going to see the damage that the sun has done. We don't control that. But there are 3 types of skin cancer I just want to mention quickly. So there's basal cell, which is probably the most common and least impactful skin cancer, and then there's squamous cell. And these are readily curable if found early. You're not going to have any problems. But again, you do need to be vigilant about it. And you can also help protect it by wearing sunscreen, even though the damage was done long ago. You should be wearing sunblock every day that the sun is out. Well, actually, even if the sun is not out, just get in the habit of wearing sunblock. Yeah. And you should be moisturizing. Which,
100% every single day.
John and I talked about.
Yeah.
So the last one is melanoma. And melanoma is a killer, and it happens fairly quickly. And so, by the time you're 70 years old, you have a 1 in 5 chance of having a melanoma. Maybe it's a 1 in 10 chance, but you can look that up. Bottom line is, I personally know people that have had melanomas and survived it, but they have to get to it right away. It has to be cut out right away. It's not as much of an emergency with the basal or squamous cell skin cancers. But I guess the big message here is that we're looking at things that are preventable. This one's preventable, so you don't have to go to therapy about it afterward. If you just see a dermatologist and continue to check yourself, look in the mirror. Men don't look in the mirror a whole lot. I always say to my wife, I can't believe how much time you spend in front of the mirror. And whereas I don't like to look at myself, so I just soon get away from that and make everybody else suffer looking at me. Yeah. But it's really important. Check your skin for anything. If anything's suspicious at all, just go get it checked out. It's you don't have to be an expert in it. You don't have to know what these things look like, but they're readily available online if you want to see a picture of them. And then when I had skin cancer here, I was easily able to look at that and say, that's nothing I've had before.
Right.
I mean, I get spots frozen off my face every year, and you're going to find that if you're a white male, you're the most likely to get skin cancer. Okay, by far. Yeah. And so when I saw that, I knew, this is something different. And sure enough, when he looked at it, he said, "Yeah, that's skin cancer."
And I think it's good to bring up moisturizing because that's like hydration for your skin, largest organ in your body. We would say, if I realize that I drink more water, and that's always encouraged, you're never going to hear someone say you shouldn't. We don't get enough water into our system, and we certainly don't get enough on our skin. Yeah. So, we're really big on preventative medicine. I think in its essence, it's about, encouraging agency on the part of men so that they can start to really encourage health. Right. That's what we're aiming for, not necessarily preventing a disorder, preventing cancer. While that helps, I think more importantly, emphasizing the importance of what we can do to create agency for ourselves and maximizing our life and life experiences. And one of them obviously being, our skin and the well-being of our skin. Yeah. I know we talked about this. Alcohol, what it does to your body. Oh yeah. It also
and your skin.
Terrible on your skin. Yeah. We don't take that into consideration enough. But again, it's another toxin that we're imbibing, and we need to be cautious of the ways in which we do it. So it's interesting that we have these kind of sociocultural scenarios where people say, I'm going to do sober October, I'm going to do dry January, and say, well, why do we need that? And it's because we drink a lot.
Because as a society, we drink pretty much every night or every other night. And on weekends, people go wild. And I don't drink anymore, rare occasion. But I can tell you that the difference in the way I feel was really something. By the way, there's a YouTube channel I'm going to plug. It's the name of the channel is The Sad Life, SAHD, Sad Life. And that guy did a 30-day, him and his wife did a 30-day sobriety. And I encourage you to watch it. It's very interesting. It's comical, but it also has some serious implications and conclusions to it. And man, they've gotten away from drinking alcohol.
Well,
I can tell you that.
And it's nice because we're talking about it in the sense that we're recognizing that if we just try to take these things in parts, we're going to have a problem here.
Yeah.
Because one might say, well, I'm okay over here, and maybe I could do better over here. But we need to start to say, well, how is the interplay of these working? When you consume alcohol, it is bad on every part of your body. But yet, what we're not taking into consideration is why. Yeah. Why am I drinking? Is it for coping or is it for celebration?
Yeah, sure.
Yeah, and we don't really analyze those types of things. No. A majority of the time, it's going to be coping.
It's coping.
It's coping. Yeah. It's coping, and we want to look at, okay, mentally, then what am I doing? Well, I'm suppressing things. I'm avoiding things. I'm distracting myself from things. This is why we really have a culture of where there are psychosomatic scenarios.
Yeah.
Where it's migraines, back pain, it's GI symptoms.
Yep.
And we're really not saying, okay, well, what does that have to do with avoidance of memories I have or emotions or traumas from the past or whatever ideas that I might be harboring? We need to take a look into that. And, what I constantly recommend to all my patients that come in is you journal, you meditate, you exercise your mind in a way where you can start to hygienically process some of the day residue that usually comes up. A lot of the times it's guilt, it's shame, it's, self-criticism or maybe conflict that you have with others that you avoid and things like that. So we want to keep that flow going. And that's a sign of a healthy system.
And I think social anxiety has a lot to do with it. When people get together and people are uncomfortable, they get a little anxiety, a little flutter. They have a drink, they calm down, they open up. What I found is that now that I don't drink, when I'm with other people, is that if let's say I'm with 3 other people, and so there's 4 of us and 3 are drinking. What I find is after their first glass, their first drink, and especially after their second, they're in a different place than I am. And, frankly, a lot of them become assholes. They're loud. They're very overly opinionated. And I don't enjoy it, to be honest with you. I can have a fine time, with people as long as they don't get to that level where, they're loud and bold and they think everybody wants to hear them. So, alcohol, the jury's in. And back in 2016, the NIH finally put out, in case this is available online, you can read the paper. The conclusion was that there is no safe amount of alcohol. And I wish people would get that out of their head. That, wine is good for your heart. That's bullshit. It's all bullshit. It was paid for by the industry, all of those all that marketing stuff, right?
Yes, chocolate's good for your heart too. Brought to you by Mars.
Right, exactly.
Mars Corporation. Look, I think in its essence, we want to ensure that when we're talking about this, we're able to recognize mentally, physically, emotionally, how all of these features and factors really contribute to our overall well-being.
Yeah.
And, whether it's pain or fatigue or it's cognitive dysfunction, it's interesting. This was from years ago where I read this. Some of the top diagnoses that you're going to see in America are depression, social anxiety, and alcohol abuse. You say, oh, wow, how do those go together?
Yeah, exactly.
So, we want to see when we're looking at disorders, mental disorders, of course, we have to assess and assume a lot of what's happening is we're repressing or avoiding, and then we feel oppressed by what we've repressed and avoided. Then we need something to kind of release ourselves from that. And of course, we feel disinhibited when we drink alcohol and looser. And of course, if there's social anxiety, that's going to help to loosen you up as well. But we go too far. So we want to try to find that balance. And I think when we're talking about these types of issues, we're saying, well, what does balance mean? What is balance and how can I create that in my life? And that's just to become aware of things like what we're talking about right now. And I know one of the things we wanted to discuss was death anxiety.
Yeah, that's a big topic, and it's something that you and I have talked about a lot. And weirdly, I thought that nobody else was like me, and apparently you are. So I was saying to John one day that I think about death a lot, and you said back to me, I think about death all the time.
Every day.
Every day. At least every day. Yeah.
Every day I think about
multiple times a day for
Absolutely.
me. Yeah.
Yeah. And I think I talked to you when I said there's a hygienic philosophy, at least I used the term hygienic before it, but it's called Stoicism. And Stoicism's come to the forefront of our consciousness in our society these days. It's talked about more often, but a concept within that is memento mori. And that means to remember your death. So by doing that, essentially you have a conscious appreciation of life.
Yeah.
By noticing that death isn't something that's out there, up there, or down there. It's something you carry with you.
Oh, yeah.
It's something you carry with you. The leading cause of death is birth. So it is always a part of our experience. The problem occurs when we try to push it out of our awareness.
Well, yeah, and it's funny because I always tell people when I talk about death with other people, I tell people I'm not afraid of being dead. That would be silly. And I think it was, who was the author? Well, anyway, famous quote, I was dead for 1 billion years before I was born, and I never even had the slightest inconvenience. Like, that's where I'm parked, okay?
Exactly.
It's dying that is the scary thing, if you really think about it. And I think that's probably what anybody feels is the transition between being alive and not being alive. And I think about that not because I'm maudlin or morbid or anything like that. I think about it to appreciate life. I mean, it helps me appreciate everything. Yeah. Every day I get up and having dodged the bullet with a heart attack and stuff like that, I don't take every day for granted. I get up and I'm like, I'm alive. Today I'm alive. Yeah. So, on one hand, it helps me appreciate the moment, and on the other hand, it reminds me that I need to appreciate the moment. That I should live in this moment, not for it, but maybe in it.
Yeah. I think confronting those painful and maybe unconscious realities, we do our best to try to kind of buffer or maybe deter. I know religion is a part of that, having notion of or some belief that you're going to go to another realm after this, where all your friends, some reassurance that, when someone close to you dies, you'll hear the cliches, she's in a better place, or it was her time, or she's with her friends and family now, these types of scenarios. But it is interesting. They've done some studies on this in regards to a person's religiosity or religiousness and how they relate to death and death anxiety. And some of the studies have pointed out that there's a difference in people's what they call intrinsic religious experience and extrinsic religious experience. The extrinsic relates to kind of a more public social life and the dogma that's associated with it. When you have the intrinsic, you're looking at someone's personal spirituality and the ways in which that affects maybe life improvement or mental health, or maybe even their capacity to problem solve. And people who have that intrinsic way of religiousness, they tend to perceive death with less anxiety. So it is quite interesting when you're able to kind of decipher between our various ways of utilizing our spirituality as a means or vehicle to support us in times where perhaps there's uncertainty around something like death. But I think that's why something like Stoicism and the concept of memento mori can be really nutritive to your experience, as opposed to, and again, buffering that anxiety and the fear or worry that might come from not just losing your life and whatever that might mean, but also maybe what you're leaving behind and what you haven't resolved with the people that you love the most. So avoidance, I think, at least from a clinical standpoint, really creates a lot of chaos, not just in select areas of our lives, but I think in regards to overall well-being. So I've noticed that, especially with some of the individuals that come in and they talk about their physical ailments. I say, well, what have you been avoiding? I literally communicate that to them quite directly. I have a problem with procrastination, or I've been neglecting this, or I don't want to face that. And I could say, okay, how do we find inroads to put our attention there?
Sure.
And it's gradual. It's not something we just kind of dive into. It's something we say, okay, how can we work our way into this? So there's an appreciation for that. But a lot of it comes from a belief. How can I face this? Do I have the tools to support that process? And a lot of the times you'll need a mentor along the way. I don't know if you know this, Gary. We might have touched upon this before, but The hero's journey that Joseph Campbell talks about, the one that so famously is incorporated into Star Wars. George Lucas used this, and then of course all the stories after that, the films after that. It's really the monomyth behind it. Really is that the formula that he uses is a story of homecoming, the return home. Mm-hmm. That the individual, whomever that is, the protagonist starts out with losing something, or something is taken from him or her, and then he has to get it back. And so we need to know that we have those little moments in our day as well. It's not just at this kind of macro mythical level. It's also in our personal lives. We have a symptom. How am I going to respond to that? Am I going to avoid it, or am I going to face it? Mm-hmm. And Joseph Campbell talks about this just in terms of, is the person going to avoid going on that journey, or are they going to confront it? Mm-hmm. And a lot of the times we don't take I think the genius of the ways in which Campbell brought that to mind. But it's not just something at a mythological level, or even something that's incorporated into storytelling. We want to see the ways in which that can be returned to how we see ourselves, and something as sacred and simple as homeostasis, letting our body heal. And so we talked about this before. You get a cut, mm-hmm. It's not like you do anything. Like, your body's just going to heal. The blood's going to coagulate. You're going to scab, and then the next thing you know, it's fine again. Now you can do things to interfere with that, mm-hmm. And I would say a majority of the times when it comes to our body healing, we get in the way. Mm-hmm. We get in the way, whether that's our mental or physical health. And one of those things would be drinking alcohol. Yeah. Yeah.
Well, certainly alcohol. I mean, for me personally, I will admit to, and I didn't realize that I was an alcohol abuser for mm-hmm. many years.
Yeah.
Now, did I ever drink on the job? No. But then after work, and I was even in executive positions, we would go out to dinner, and, there would always be a bottle of wine. I mean, yeah. or two. And depending on, how many people you were with and how much people were going to drink. But there was always alcohol involved. Yeah. And so I just got used to that. And I, to be honest with you, I never thought that I was abusing alcohol. If I drank 2 or 3 glasses of wine a night, I thought that was fine. And it didn't occur to me till much later in life that, hey, this is taking its toll on me. I mean, I became aware of it. I think a lot of people just aren't aware of the dangers. And you talking about avoidance, conflict avoidance, it brings me to the point of blood pressure, which we didn't talk about last time at all, which I'm shocked I didn't remember to talk about it, given I was talking about the heart. But blood pressure is so easy now to manage and to diagnose. It's self-diagnosable. You could buy a blood pressure cuff in the store. They're very accurate. I keep one here. And there are many medicines to choose from, but very effective ones, very safe ones. There's no reason to walk around with high blood pressure and you're aiming for a heart attack or a stroke or something. Clearly, this is something that people can do something about themselves. A couple others are diabetes. I mean, to the extent that we crave carbs, alcohol is not your friend when it comes to diabetes, mm-hmm. and will raise your triglycerides, which is essentially raising the glucose in your system. So I just wanted to mention those things in the context of well-being and talking about how people hold conflict in, don't address things. These are all become symptomatic physiologically from your perspective psychologically, that they're connected, they're interconnected forever, and you can't change that. So you're right about the boxes that doctors put you in, but if they can't look at it holistically, then you need to be engaged, which was the message of the last podcast.
We need to challenge the norms that we're exposed to. We go into a doctor and we look up to this individual, and he has a certain level of expertise and authority, and we say, well, you tell me, and strangely enough, I've had moments where I've had certain patients kind of reference that in regards to their mental health issues. And I said, well, if you do want my advice or information or encouragement on something and support, we're going to have to do this together, mm-hmm. because my role is to ask the questions, the right questions. His role is to uncover the answers within him that are buried beyond all the BS. Mm-hmm. And a lot of that BS is essentially the defenses that he's erected so that he doesn't have to confront certain realities. A lot of those realities have to do with life experiences and events that he foreclosed on because they're too painful to confront. But the good thing about therapy is it does provide you with, I think, an orientation that allows you to recognize that if I face this in this one area of my life, it almost gives you a little momentum to face it in other areas of your life. Mm-hmm. Like if I can, let me take a look at this obesity issue. Okay, why am I eating so much? What is food providing for? What is food symbolically to me?
Right.
Where do I feel deprived in my life? What am I neglecting or avoiding or negating? How is food compensatory in that way?
Yeah.
And then, we'd look into other things like fatigue. A majority of the times when I listen to a person talking about their depression, fatigue is always there. Insomnia is always there.
Yeah, insomnia. It's a definite one.
It's always there. And erectile dysfunction is always there.
Yeah.
In some ways we're saying, what is your body communicating to me?
Yeah.
And that's an important thing to take into consideration. I tell you, I've had many men come into my office with erectile dysfunction, and we've talked about, why isn't your body able to provide you with an experience? A lot of times, I didn't feel safe. I didn't feel safe. I didn't feel safe for this woman. I didn't feel safe in this situation. Or there's something that I'm bringing up, or there's something that she's bringing up. And we say, are you talking about that? No, I'm just popping a Viagra.
Yeah.
So, there's an issue there that we want to explore and unpack. So whether it's ED or whether it's obesity or diabetes or whether it's fatigue or whether it's any type of cognitive disruption in terms of memory or judgment or decision making, we want to take a look deeper, and we want to start to explore what factors are not only contributing to the disorder or the disease, but what factors do we need to start to introduce that help to facilitate healing.
And every man out there knows that the wrong thought at the wrong moment
100%.
can make you lose an erection
100%.
faster than your car keys.
100%.
I mean, and you're done. You're done.
So that is a perfect example of the ways in which the mind
we're connected.
And the body are connected.
Yeah, completely.
But we're not taking that. What was I thinking? Why was I thinking that? Then you start to overanalyze and things like that. But it's good to create a space where you can normalize what that is and then soften that so that you can reconnect.
Yeah.
And that's what I was mentioning before in regards to returning to harmony. You're trying to reconnect to a place where you feel safe and secure again. Yeah. And if you're having those negative thoughts, if you're having those anxious thoughts, performance anxiety thoughts, it's going to disrupt your ability to get an erection. It will also disrupt your ability to fall asleep.
Yeah.
So many individuals I work with, they're forecasting before they go to bed and worrying about the next day or ruminating on the past.
Or to the extent they do sleep, they might not get quality sleep.
Or they'll wake up in the middle of the night and think, oh, okay, well, and then the first thing I'll ask them is, well, what were you thinking about when you woke up? I was worrying about this, and I was
worried about tomorrow's hard on.
Exactly. I'm worried about God punishing me for masturbating. Whatever it might be.
Whatever it might be. They worry too much.
Yeah, it is. So, Einstein used the term passionately curious.
Uh-huh.
He referenced this in regards to his genius. He said, I'm just passionately curious. I don't think there's anything really special about me with the exception of the fact that I'm curious. And I said, then we all can be Einstein then.
Sure.
So we can be passionately curious about our lives, our physical, mental, and spiritual lives, and the ways in which we can dedicate that to a healthier relational experience with the people around us. But I use the term redemption a lot in my work. It's sometimes you'll hear it in religious circles, but it's also used in storytelling as well. Mm-hmm. But it's essentially reconnecting to your core meaning, your true self, bringing yourself back to a place or repositioning yourself in a way where you can start to integrate all facets of yourself so that you can optimize what you have. But I also use it in the service of redeeming the lost parts of you that you've neglected and negated. Mm-hmm. And usually those are potentials that we've foreclosed on because we're so worried about being exposed to our wounds. So there's a saying, the wound that you resist also is interfering with your ability to experience your destiny. And that's why most people don't optimize their full life potentials, because the wound stands in the way.
Yeah.
So once we start to acclimate to those parts of ourselves that we've rejected, we can now open ourselves up to and optimize our full life capacities and creative life energies.
I mean, I think that at least this works for me. What I do is I sort of try to carry around this seeking of well-being.
Mm-hmm.
Like, I think about it often.
Yeah.
And when there are things that I need to do or things that I'm planning, I take into consideration, is this going to further my well-being?
Yeah.
Because at the end of the day, if you're a human on this planet, the well-being is everything, right? Yeah. Without that, what kind of existence can you have, really? A quality existence. So love and expressing emotion and being in touch with your overall well-being mm-hmm. are critical to living a good life, I think.
Yeah.
And when people say he lived his best life, that you want to consider that as a part of it.
Yeah.
And along those lines, I know a lot of men my age, and I'm going to mention a specific disease because I didn't in the men's health episode, but I wanted to mention prostate cancer because this is a disease that in the past have been overdiagnosed. Mm-hmm. So many men suffered from having their prostate poked at and a biopsy taken, and there's some low amount of risk with that. It's a very painful test. But also, some people have their prostate removed for no good reason, and when you have your prostate removed, generally your sex life is going to be a struggle. You're going to have problems, and this is going to get up here because once that happens, it's a big deal. It's a life changer, an absolute life changer. But what I wanted to mention is that not too long ago, the medical establishment came out with a paper and decided that men over 70 don't need to get tested anymore. Their PSA doesn't need to be measured. There shouldn't be a digital exam after like 65.
Really?
Yeah.
Wow.
And the problem with that is that from a statistical perspective, I can't disagree. The numbers are what they are. But if from an individual's perspective, men need to be aware that there's good reason for them personally, especially if prostate cancer runs in their family, but even if it doesn't. I can give you two good examples. I've known men in their 50s who have had their prostates removed for an aggressive cancer that they wouldn't have found if they didn't have the test.
Right.
But then going into your 60s, you're not giving up at that point. Even your 70s, where I'm at, you're not giving up life. So I have a neighbor who at 79 was diagnosed with prostate cancer because he's a doctor, and he didn't fall for the statistically this is fine, I should be fine. He was like, no, I'm going to take care of me. So he was engaged, and so he kept a check on it. Got prostate cancer. It was an aggressive cancer. So they had to do the full surgery, and then he had to go through chemo. He's 81 now. It's 2 years later. He's out hiking 5 miles every day, whereas he would have been dead. My point is that just because that's what the establishment is right now and what it recommends, doesn't mean that you as an individual, that you should follow that. I don't. I get my PSA checked every year, and I think it's important.
Yeah, I think we don't want to wait for a crisis to occur in order to be the catalyst for us to consider our well-being. I think, even from a mental health standpoint, the only reason as to why someone would come in my office if there is a crisis. The interesting thing that I found is that most people come in with some type of a salient kind of topical presenting issue, but then what they find out is that there's all this other stuff that hasn't been excavated. I had a patient recently after working for about a year together, and he said, what's amazing? I feel like I don't need to see you anymore, but I need to let you know the reasons why I came in here, really, we didn't even need to address. It was all this other stuff that I had that was really the issue. And that's what I feel so appreciative of. Mm-hmm. So it is interesting as we start to become, somebody brings our attention to it, or we're actively invested in being circumspect with that. It's really amazing the ways in which we can allow for self-agency in our lives and feeling more self-efficacy. So I think in its essence, we want to establish a hygienic philosophy around our physical health, our mental health, and maybe even our spiritual well-being as well. I think taking some time to even examine the ways in which certain life narratives or belief systems shape your existence and how you see yourself and relationships around you, it's an important thing to do. So when we're talking about well-being, it's about self-monitoring. And that in its essence, I think can be empowering. So, but yeah, we want to look out for those imbalances. We want to go a little bit deeper and try to uncover if there is anything on our own that we can start to explore and maybe uncover. But I think overall, then that brings you to a greater state of resilience. You're going to be able to bounce back from life experiences or from any type of physical disruption, and that will then stave off whatever problems that you might have with mortality or anxiety around it.
I do wonder why men seem to be. Well, I mean, if we went back and studied history, we can come up with a lot of hypotheses about why men are so afraid, I'll say, of getting involved and engaging in, if it means conflict. I mean, they just avoid it. Especially it seems to me at a certain age, they lay down even more. I mean, they become less, or I should say more conflict avoiding than they were previously. Yeah. And what is it that starts that out? I mean, it's, okay, historically we have lots of history, but at one time, I mean, Julius Caesar decided, he was going to cross the Rubicon and in a civil war with the rest of Rome, take it to defeat and become an emperor. Mm-hmm. And he did that. And so, I'm not saying we don't have those kind of people anymore, those kind of men, but you wonder if back in the days of Rome or even further in Greece, whether men were just much more conscious of themselves and were more in touch with what they were feeling. And you would think not, because it's been so long ago, but then I look at today, it's not been long, right? In the grand scheme of time, the Earth is 4.5 billion years old. So I may be getting off the track, but I mean, you know what I'm saying? This is all, we've all been squeezed, human beings, into a few seconds relative to the Earth's timeline. Yeah. And so, what is it that's changed today from ancient Rome, for example, or has it not changed?
I think the Industrial Revolution had a lot to do with it.
Two of them, right?
Yeah. And then you think of the assembly line with Ford and whatnot. We all have our little duty and we do it, and then we get a product in the end. And I think we tend to do that with ourselves. I think prior to that, we were kind of more aligned with and involved in nature. And we start to separate and segregate and create these hierarchical kind of paradigms. Yeah. And it's unfortunate. I think it would be nice to kind of return to an experience where we could start to see ourselves more holistically. But I also know that we're hampered by society and the ways in which we view it and others view us. So it really takes personal responsibility to get to a point where you can kind of educate yourself and start to explore the ways in which you can find a mentor or maybe a therapist or someone in your life who you can turn to and talk about these things. And we talked about this in previous podcasts, but men don't have early childhood experiences where their verbal abilities are trained or reinforced by the people around them.
It's interesting.
It is. So when you see what you see happen is kind of lean to passive or aggressive. And then most people settle for passive aggressive. And I'm going to say with every single person that I talk to, we always talk about assertiveness. Always. Setting boundaries, articulating your needs and feelings, finding ways to communicate your goals and interests. And we just don't learn that.
I've been accused of being arrogant because I am assertive. In the industry that I was in. Yeah. I happened to be a leader, and you couldn't be an effective leader without being assertive. So I always asserted myself. But I've been accused of many things because of that.
And that's an interesting point here, because I would say when I reference confidence, feeling more self-confidence, people say, well, that's arrogance. Yeah. And they default to the pejorative term in that regard. But I think what we'd like to be able to say is you were asserting yourself. Yeah. And people might interpret that as arrogance or aggressiveness. So we're not just, most people are going to say, well, how do other people view me? That's how they're going to begin. Yeah. If I say this, how might someone view me?
But isn't that the people that are looking at you saying, well, he's arrogant because he's assertive, isn't that really mostly people who can't assert themselves.
Yeah, of course, because their perspective is skewed based upon how they would think or act.
Yeah.
So I don't know what look, I barely know what I think. I'm not going to try to assume what they think. Yeah. And if I gauge how I'm going to communicate this based upon how someone else is going to take it, I might not say anything because I'm basing it on some uncertainty or assumption.
Right. Plus, there's such a variance for me. Like if I were in a meeting or I were giving a talk or something like that, there's maybe, let's say, 20 people in a room. I don't know how each one of those are going to perceive me when I speak, nor do I design anything for that. I'm informed by the things that I've absorbed over the years and what I think is going to be effective and maybe inspiring, maybe motivating, maybe just passing on information. But I'm certainly not going to take into consideration how 20 people are going to see me individually. That you just can't do that.
You can't do that. I think the problems usually occur in individual, scenarios, interpersonal, intimate scenarios. And a lot of it has to do with, if I say this, I might hurt their feelings. Yeah. If I say that, I might harm them. What I've noticed is that in depressive personalities or people who have scenarios or symptoms of depression, what I've heard from a lot of my patients is they'll say, well, if I say this, this might harm them or hurt their feelings. Yeah. And I said, so in lieu of not saying it, then do you recognize that you're harming yourself? Yeah. And a lot of the times they'll say, I do, and I'll accept that. So self-harm is okay, but harming another. But the problem is the assumption that my words would hurt them. Yeah. As opposed to my words could either communicate my needs and feelings, or they could reestablish harmony within the relationship. But some element of confrontation is essential in order for some resolution to occur. We don't see it that way because we don't learn that in schools. Yeah. We don't learn conflict resolution. We don't learn how to assert ourselves. We don't learn boundaries. We don't learn, how to regulate our emotions. I mean, if I could create a school, that would be the first thing that I would do. And I'd teach kids early on because that's necessary in order for them to be effective communicators. Mm-hmm. Effective communicators. Mm-hmm. We don't even use that term. What does effective communication mean? It means that I have certain needs, feelings, and interests. And I need to learn how to communicate that to them in a way that aligns with my values, but also in a way that I could imagine they would receive. I imagine they would receive it in the way that I would like to receive it, so that I would be amenable to what they're communicating. Right. Begins with knowing yourself in that regard. Right. So.
Well, we've covered a lot of ground here. It always seems to go by so fast. I mean, we're at 45 minutes already. But anyway, the subject was well-being, and we wanted to cover as many aspects of that as we could in 45 minutes, including our physical health, our mental health, and basically a holistic view and what well-being means and why we should be focused on it. So it affects us physically and mentally, and we need to take care of those things and be engaged. I mean, that's the key thing, is be engaged in your own well-being overall.
Yes. And noticing that we're constantly, something internal to us, whether it's in our mind or body, is trying to return us to a state of harmony and balance. So if we create a perspective that recognizes that imbalance, that notices an imbalance somewhere, then I can work towards trying to facilitate that. Right. And that would be a wonderful way of living, I think, for most people.
Okay.
Yeah.
Well, from the middle, I'm Gary Illman.
And I'm John Beradino.
And we'll see you on the next episode. Thanks for checking in. And if you get a chance and you like our content, please hit the subscribe button and give us a thumbs up. Appreciate it.
Thank you.